The darker the colour, the more red the colour, the higher the rates of overdose. So 2010, 11, 12, 13, 14, 15, and that was 2016 last year. I don't think I need to tell you that there has been an incredible increase, and it appears to be all around the province. Peers are really important. They know the realities, they give us great suggestions on how to improve things. They also identify unintended consequences. We all think what we're doing is the best thing, that we know best, but we don't. We need the reality of people who use substances to tell us where there may be unintended consequences.
From December 8th to January 22nd, 1,963 people used the site. So that's a tremendous amount of people that have come in. With those, there was 11 ODs, which is, you may think 1,963 people, only 11 ODs, but that's 11 people saved, right? I guess the biggest number that I can give you is people that have come in that have never used Insight. We're not like Insight. Insight has nurses and everything else. We don't. We're all peers. We're all, like I said, either former users or current users. And we try to help each other because we all know it's a place where people can come and they understand. They don't get looked down on. Everyone that's there has been there. They know what you've been through. They know what you've seen. We've seen it all. We've seen it. We've been there. We understand. So they don't feel stigmatized. They don't feel rushed or hurried just to get in, get your shot done, and leave. I wish it hadn't taken a crisis to bring us to where we are today. I wish we could have got together as a society, as human beings, and said, okay, let's get together, let's see what we can do to stop this, how we can make people understand that they don't need to be alone when they do this. They don't need to do it. Most of the ODs are happening. People are in their rooms by themselves or in back alleys by themselves, and that's where they're told that that's the best place for them.
When we put people in a place of fear that they can't even reach out and ask for help, whether it's for themselves or someone else, that's a problem. Because if we couldn't phone 911 for whatever reason, and there are so many reasons, whether you have children in the home or you have a threat of violence, if you do, depending on where you are, it's very real. Those are some of the things that people don't talk about or think about when they decide, make decisions for us, without us. Plans, unique safety plans. I've had women in my office where I ask them to lift up, be able to carry their friend's dead weight for a certain amount of yards so they could get out of the house. If they're in a shack, if they're working in a trap house, if they're working someplace where there's criminal activity and that they cannot respond. Your scope may not be mine. I may not be able to do what you can do, and you may not be able to do what I can do. We can go into places, we can be an extension. That engagement, and we know this now, it's not about what treatment you take, it's about engaging. And so if we can't bring people in to engage into the healthcare, we cannot move any further.